Hello everyone, this is Neelam Jyotinath. In this video, we will be discussing about hypomagnesemic tetany. Hypomagnesemic tetany, simply called as hypomagnesemia, is also known as grass staggers, and it is also known as wheat pasture poisoning. Hypomagnesemic tetany is a highly fatal metabolic disease characterized by hypomagnesemia, muscular spasm, hyperexcitability, convulsions, and rapid death. Hypomagnesemia occurs when the total magnesium level falls below 1.5 mg per dl in plasma and below 1 mg per dl in cerebrospinal fluid. Cattle, buffaloes, sheep, goats, and calves are commonly affected, but the cause of hypomagnesemia is somewhat different in calves. On this basis, the tetany can be subdivided into two major groups: hypomagnesemic tetany of calves, which is caused by primary deficiency of magnesium in diet, and hypomagnesemic tetany of cows, buffaloes, sheep, or goats, in which there may or may not be a primary deficiency of magnesium in feed, but some nutritional or metabolic factors reduce the availability of magnesium to the body or increase its excretion, leading to a secondary deficiency. Now we come to epidemiology. Talking about the incidence, hypomagnesemic tetany is variable. Cows, buffaloes, ewes and does are affected. Magnesium deficiency is uncommon in simple-stomached animals and human beings due to adequate concentration of element in food. Generally, 4 to 7 years age group is affected as mobilization of magnesium from bone decreases with age. Mostly females are affected. Both pregnant and lactating females are affected. It usually occurs in cows in first 2 months of lactation and 1 to 4 weeks after lambing in ewes. The ewes with twins are more affected than singles. High-yielding are more prone to this disorder. Hypomagnesemia is common during cold winter due to depression of appetite and a negative energy balance during bad weather. Talking about economic importance, although effective treatment is available, the case fatality rate is high because of short course. Now we come to etiology. This condition is caused by hypomagnesemia, which is due to dietary deficiency of magnesium, decreased or unavailability of magnesium, and drain of magnesium or loss of magnesium. Talking about dietary deficiency of magnesium, hypomagnesemia can occur due to grazing on young green grass or lush pasture, which is poor in magnesium and sodium and rich in potassium and nitrogen. Therefore, it is also called as grass tetany. It can also occur due to excess feeding of young green cereal crops, which are deficient in magnesium and sodium and rich in potassium. Hence, it is also known as wheat pasture poisoning. Highly leached acid, sandy soils are usually deficient in magnesium, whereas black and brown soils are rich in magnesium. High potassium and aluminum in soil reduces magnesium availability to plants. Heavy application of potash, ammonia and nitrogen-rich fertilizers also reduce uptake of magnesium by crops. Starvation for 24 to 48 hours due to bad weather, transportation, etc. leads to hypomagnesemia due to low dry matter and energy intake. Now we come to the second etiology, that is decreased or unavailability of magnesium. It can occur due to diarrhea, presence of chelating agent, diet rich in protein or nitrogen, high potassium content diets, and grasses with high ratio of potassium, calcium or magnesium. Now we come to the next etiology, that is drain of magnesium or increased loss of magnesium. The excess loss of magnesium through milk results in hypomagnesemia. Increased demand of magnesium for growth of fetus also results in hypomagnesemia. The worst combination of causative factors is low dietary intake in recently calved cows during a spell of cold windy weather. Now let us discuss about the pathogenesis. As discussed earlier, excess feeding of green lush pasture, high potassium nitrogen in diet and diarrhea and heavy milk yield, these are the causes which ultimately leads to hypomagnesemia. Now let us consider this. Magnesium is neurosedative and helpful in maintaining normal nerve impulse transmission. Due to deficiency of magnesium, there is neuroexcitation, and this ultimately leads to tetany and hyperesthesia. Also, change in magnesium and calcium ratio stimulates the secretion of acetylcholine esterase, which is antagonistic to acetylcholine. And acetylcholine is a substance required for nerve impulse transmission. So this will also lead to tetany and hyperesthesia. Differential diagnosis of hypomagnesemia must be made from the following. Acute lead poisoning. There will be history of access to lead. Clinical signs will include blindness, and there will be no response to magnesium therapy. In rabies, there will be history of dog bite. Clinical signs will include ascending paralysis and absence of tetany, and there will be no response to magnesium therapy. In nervous form of ketosis, there will be absence of tetany, hypoglycemia and ketonuria will be there, and this will be responded by glucose therapy. Coming to strychnine poisoning, these are actually very rare in ruminants, and there will be history of access to strychnine. In chlorinated hydrocarbon poisoning, there will be history of access to poison and no complete response to magnesium therapy. Surra occurs during monsoon season, and blood smear will be positive for Trypanosoma species. Surra responses to quinapyramine. Now coming to treatment. The safest general recommendation is to use a combination of calcium-magnesium preparation intravenously followed by subcutaneous injection of magnesium sulfate. For example, Mifex. Symptomatic treatment includes use of sedatives to control convulsions. For example, chlorpromazine HCl. Coming to the control part, feeding of magnesium salts during danger period is recommended. Magnesium oxide is commonly used as supplement. Top dressing of pasture with magnesium-rich fertilizers is recommended. For example, calcined magnesite at the rate 1125 kg per hectare is satisfactory. Magnesium content of pasture can be raised by spraying 2% salt of magnesium sulfate at fortnightly interval. Provision of magnesium sulfate at 500 g per 100 liter through drinking water during risk period is effective. Dairy animals should be provided with comfortable shelter during winter. Provide hay along with greens. So these are the references of the presentation. With this, I conclude my presentation. Thank you very much. This is Neelam Jyotinath signing off. Thank you.